welcome back to osteology classes, and today we will learn about Norma basalis. Observation of the skull from inferior aspect without mandible is Norma basalis. To learn this Norma basalis in an easier way, we can divide it into three parts: anterior, middle and posterior. Let's go ahead with the anterior part first. Anterior part of Norma basalis is formed by alveolar arch which possesses bony sockets for teeth of upper jaw. And in the middle, it is formed by the hard palate. Posterior border of the hard palate separates the anterior part from the middle part of Norma basalis. Let's see more features about anterior part. So, looking on the posterior border here, it is identified by projection which is known as posterior nasal spine. And let's see the bones contributing the formation of hard palate. Anterior 2/3 of the hard palate is formed by palatine process of maxillae. So we know already there are two maxillae, right and left, and this right and left maxillae projects forming a palatine process which meets with each other at intermaxillary suture, forming anterior 2/3 of the hard palate. Posterior 1/3 of the hard palate is formed by horizontal plates of palatine bone. And both right and left palatine bones, just like palatine process of maxillae, they too meet in the midline at interpalatine suture. And next about the palato-maxillary suture. Palato-maxillary suture is the suture between the anterior 2/3 and posterior 1/3, that is between the palatine process of maxillae and posterior horizontal plate of palatine bone. They both join to form palato-maxillary suture. And if we join all these sutures and see, it appears to be like a cruciform. So it is named as cruciform suture altogether. And one more thing is near the posterior border of the hard palate. So just next to the posterior border of the hard palate, there are faint elevations like curved ridges which are called as palatine crest. And now we shall understand about the openings, that is the foramina present in the anterior part of Norma basalis. So first is the incisive fossa. Incisive fossa is present just behind the incisor teeth. So it is a deep depression present just behind the incisor teeth. And this incisive fossa, if we see keenly, it contains two openings, right and left incisive canals. Incisive canal transmits nasopalatine nerve and greater palatine vessels. Now we shall talk about greater palatine foramen and lesser palatine foramen. These foramens are appreciated on the posterolateral aspect of hard palate. Greater palatine foramen, they are present on each side. They are little prominent and little larger than the lesser palatine. And greater palatine vessels and nerve pass through greater palatine foramen. And this foramen is present near palato-maxillary suture. Let's talk about lesser palatine foramen. These are minute, tiny foramens. They are around 1 to 3 foramina located on just behind the greater palatine foramen on each side near the pyramidal process of palatine bone. And this lesser palatine foramina transmits lesser palatine vessels and nerves. So it is easy to remember. Greater palatine foramen transmits greater palatine vessels and nerve, and lesser palatine foramen transmits lesser palatine vessels and nerves. And one more point to know in anterior part is premaxilla. Premaxilla is a triangular piece of maxilla holding the 4 incisor teeth. In other vertebrates, not in humans, it is present as a separate bone, but in humans it is a part of maxilla. So this is all about anterior part of Norma basalis. Let's study about the middle part of Norma basalis. Middle part, it extends from the posterior border of hard palate anteriorly, and posteriorly it extends up to an imaginary line which is drawn across the margins of foramen magnum, separating the middle part from the posterior part of Norma basalis. Now we shall talk about its features. To learn the features of middle part of Norma basalis, we can divide into the center median area and right and left lateral areas on each side. Now have a look at this center median area. Anteriorly we can see 2 openings which are called as posterior nasal apertures. These are the openings of nasal cavity from the posterior side, and these apertures are also termed as posterior choanae. And these apertures, they are separated by a bony partition. So the bone which splits into right and left posterior nasal apertures is vomer. So the vomer is a thin plate like bone which makes the major part of nasal septum. And if you observe, the vomer splits into 2 thin bony plates which are known as ala of vomer. So these alae articulates with the anterior end of the sphenoid, which is nothing but the rostrum of sphenoid. Posterior to this vomer, we can see a wedge-shaped bony bar, and this bone is formed by 2 structures, that is the inferior surface of the body of the sphenoid and basilar part of occipital bone, which is nothing but the basi-occiput. So the body of the sphenoid and the basi-occiput, they fuse completely to form this wedge-shaped bone. Extends till the anterior margins of foramen magnum. And this bony bar on the inferior side, we can see it is quite irregular because of some pits. And these pits are meant for the pharyngeal tonsil, which makes the roof of pharynx. And this inferior surface of the sphenoid and basi-occiput is marked by a median projection, a bony projection, which is known as pharyngeal tubercle. Now have a look on the lateral areas of the middle part of Norma basalis. These lateral areas on each side, they are formed by 2 parts of sphenoid and 3 parts of temporal bone. So let's see what are these. So the 2 parts of sphenoid are pterygoid process and greater wing of sphenoid. And the 3 parts of temporal bone are petrous part, tympanic part and squamous part of temporal bone. So we shall see each one in detail now. So starting with this pterygoid process. So the pterygoid process is the process from the sphenoid, and it present posterior to the last molar tooth. If you see, it is present just behind the last socket, last molar tooth. The pterygoid process shows 2 pterygoid plates, lateral and medial pterygoid plates. And lateral pterygoid plate is quite broad, and it makes a boundary of infratemporal fossa. So it forms the medial wall of infratemporal fossa, which is well appreciated in Norma lateralis. The medial plate shows a prolongation which is called as pterygoid hamulus. This pterygoid hamulus is called hamulus because it is hammer-like or hook-like prolongation. And the groove which is present between this medial and lateral pterygoid plate is pterygoid fossa. If we trace the medial pterygoid plate near the body of the sphenoid, it splits by enclosing a small triangular fossa which is called as scaphoid fossa. So we can make out that scaphoid fossa is different from pterygoid fossa. Pterygoid fossa is the fossa between two plates, medial and lateral pterygoid plates. Scaphoid fossa is formed by the medial pterygoid plate itself. It is a very small triangular depression present near the body of the sphenoid. And if we trace the medial pterygoid plate at the site of articulation near to the sphenoid, it articulates with the palatine bone anteriorly. So, the palatine bone has a projection called as sphenoidal process of palatine bone. So, the medial pterygoid plate articulates with the sphenoidal process of palatine bone by making a prolonged process. So, if we trace the medial pterygoid plate, it continues as a process which is called as vaginal process. So, this vaginal process of medial pterygoid plate is associated with two tiny foramens. I hope you can appreciate in this picture. The two tiny foramens are seen where the vaginal process of medial pterygoid plate articulates. The anterior one is palatino-vaginal canal or pharyngeal canal, and the vomerovaginal canal, which is also a tiny foramen, lies little posterior to the pharyngeal canal. Let's see palatino-vaginal canal or pharyngeal canal. This canal is present between the vaginal process of medial pterygoid plate and sphenoidal process of palatine bone. So, we can see a gap between the vaginal process of medial pterygoid plate and sphenoidal process of palatine bone. This gap is pharyngeal canal, and this canal leads anteriorly into pterygopalatine fossa, which contains a ganglion called pterygopalatine ganglion. So, this palatino-vaginal canal transmits branches from the pterygopalatine ganglion and branches of maxillary artery, that is the pharyngeal branches of third part of maxillary artery. Let's talk about the next foramen, that is the vomerovaginal canal, which is also a tiny foramen, lies little posterior to the pharyngeal canal, and as the name says, it is between the vomer and the vaginal process of medial pterygoid plate. So, vomerovaginal canal. So, we know already the vomer, where it articulates with the sphenoid, it makes an alley. So, each ala will articulate with the vaginal process of the medial pterygoid plate. So, at the site of articulation, we can see this gap, which is termed as vomerovaginal canal, and this canal transmits pharyngeal nerve and vessels. So, now we know palatino-vaginal and vomerovaginal canal, which are present in the median area of middle part of Norma basalis. Let's see the other features in the lateral side. So, lateral surface, we know it is majorly formed by the greater wing of sphenoid, and this greater wing of sphenoid also forms the roof of infratemporal fossa, which is also well appreciated in Norma lateralis. And over the sphenoid, there are two important foramina. One is the foramen ovale, which is very prominently seen and oval in shape, so it is called as foramen ovale. To remember the structures passing through this foramen ovale, we can make a mnemonic as MALE, M-A-L-E. M stands for mandibular nerve, A for accessory meningeal artery, L for lesser petrosal nerve, and E for emissary vein. So, these are the structures passing through foramen ovale. Posterior lateral to this foramen ovale, there is a small foramen, a tiny one, which is termed as foramen spinosum. Why it is called spinosum? Because it is next to a very sharp projection from the sphenoid, which is called spine of sphenoid. So this foramen is very near to the spine of sphenoid, associated with the spine of sphenoid. So it is called foramen spinosum. And let's see what it transmits. It transmits an important neurovascular bundle which supplies major part of meninges in the middle cranial fossa. So what is that neurovascular bundle? It is the recurrent branch of mandibular nerve, which is also called nervus spinosus. Recurrent means it is recurring back. So we know mandibular nerve is already a content of foramen ovale. So when it comes out through the foramen ovale, immediately a recurrent branch is given from the trunk of the mandibular nerve, which travels back again into the cranial cavity to supply the meninges in the middle cranial fossa. So that is the reason it is called recurrent meningeal branch of mandibular. As it passes through foramen spinosum, it is also called nervus spinosus. Along with this nerve, the vessels are middle meningeal vessels, middle meningeal artery and middle meningeal vein, which also supplies the major part of meninges. So that is about the foramen spinosum. Next, moving on to the temporal bone. So the junction between the greater wing of the sphenoid and petrous part of temporal bone is marked by a sulcus. This sulcus is sulcus tubae, and in living it lodges cartilaginous part of eustachian tube. So that is about the sulcus tubae. If we see the medial end of the petrous part of temporal bone, it is quite pointed, which is called apex of petrous part of temporal bone. The foramens seen in petrous part is carotid canal. This carotid canal transmits internal carotid artery, which supplies major part of brain, and always the large artery is associated with its sympathetic plexus. So internal carotid artery along with its sympathetic plexus passes through this carotid canal. Just observe next to the body of the sphenoid and the petrous part. So the gap between this body of the sphenoid and the apex of the petrous part of temporal bone is foramen lacerum. It is quite irregular foramen with irregular margins. That is the reason it is called foramen lacerum. Only two structures pass through it. One is the meningeal branch of ascending pharyngeal artery and the emissary vein. And the importance of this foramen is interiorly this carotid canal, what we just saw over the petrous part, carotid canal and the pterygoid canal, they open up into the foramen lacerum from inside. Let's see the other parts of temporal bone. So talking about this tympanic part. Tympanic part of temporal is a triangular bone which occupies the angle between the petrous and the squamous part of temporal bone. And in Norma basalis we can see a little part of squamous part of temporal bone also. So that squamous part makes a fossa, that is a depression called as mandibular fossa, and this mandibular fossa articulates with the head of the mandible to form temporomandibular joint. And anterior to this mandibular fossa, the small bony elevation is articular tubercle. Next we shall talk about the squamotympanic fissure. Fissure means the gap between the bones, which is a long gap. Not like foramen means a hole which is rounded. Fissure means a long gap. So squamotympanic fissure is a gap present between the squamous part of temporal bone and tympanic part of temporal bone. So squamotympanic fissure transmits chorda tympani nerve, which is a branch of facial nerve, anterior tympanic artery and anterior ligament of malleus. So these three structures passes through petrotympanic fissure. So this is all about the features, foramens and structures passing through the foramens of middle part of Norma basalis. Let us understand the posterior part of Norma basalis. The posterior part of Norma basalis extends from an imaginary line which is drawn across the anterior margins of foramen magnum. This imaginary line separates the posterior part from middle part of Norma basalis. Posteriorly it extends till a bony prominence which is external occipital protuberance. And on each side of external occipital protuberance there are arching lines called superior nuchal lines. So external occipital protuberance along with the superior nuchal line demarcates Norma basalis from Norma occipitalis. So let's talk about the features of Norma basalis posterior part. So the posterior part, for our convenience, we divide it as the median area and two lateral areas, and the median area is marked by a large foramen which is ovoid in shape, which is the largest foramen in the skull, is foramen magnum. It is the communication between the cranial cavity and vertebral canal. To remember the structures passing through this foramen magnum, for our easy learning, we divide it as anterior and posterior parts. Anterior ligamentous compartment and posterior neurovascular compartment. So starting with this anterior ligamentous, that is ligaments are there in this anterior part, we can see the apical ligament of dens. Apical ligament means it is the ligaments attached to the apex of odontoid process or dens. Dens or odontoid process is the projection from second cervical vertebra axis. So from the axis the projection is the dens, and from the tip of the dens the ligament which is attached and crosses this foramen magnum is apical ligament of dens. Along with the apical ligament, superior longitudinal band of cruciform ligament, membrana tectoria are also present. Now moving on to this posterior neurovascular compartment. So posterior neurovascular means nervous tissue and blood vessels are seen on the posterior aspect. So the most important content is the lower part of medulla oblongata. So lower part of medulla oblongata is the lower part of brain which continues below the foramen magnum as the spinal cord. And this medulla is surrounded by the meninges, dura mater, arachnoid and pia mater, which continues as the meninges of the spinal cord too. And there are spinal roots of accessory nerve, that is the spinal part of 11th cranial nerve, also crosses the foramen magnum. Meningeal branch of upper cervical, which is a sensory nerve supplying the meninges of the posterior cranial fossa. And vertebral arteries are present, and sympathetic plexus around these vertebral arteries, anterior and posterior spinal arteries. So these are the important contents which pass through foramen magnum. The other features in the median part of posterior Norma basalis, we can see the projection here which is external occipital protuberance. From external occipital protuberance, if we trace anteriorly till the foramen magnum, there is a median crest, median elevation of bone called as external occipital crest. And let's talk about the lateral areas. The lateral areas, just anterior laterally to the foramen magnum, we can see nice condyles which are termed as occipital condyles. These condyles articulate with the first cervical vertebra, which is the atlas. And the foramens associated with these condyles are, one is the hypoglossal canal. Hypoglossal nerve is the 12th cranial nerve. So the nerve passing through this canal is hypogloss. That is the reason it is called hypoglossal canal. Hypoglossal canal is located hiding anterior to the occipital condyles. So it is difficult to identify the canal from basalis view. But if you put a probe, the internal opening of it we can see along the margins of foramen magnum in the posterior cranial fossa, which is appreciated along the inner margins of foramen magnum. So this is the hypoglossal canal and it transmits hypoglossal nerve, meningeal branch of ascending pharyngeal artery and emissary vein. And the other lateral areas is formed by the squamous part of occipital bone, which is marked by superior nuchal lines on each side. And these superior nuchal lines are well defined ridges on each side of external occipital protuberance. Next, along the superior nuchal lines, the parallel lines which are present on each side of external occipital crest are inferior nuchal lines. Inferior nuchal lines are anterior to the superior nuchal lines on each side of external occipital crest. Now we shall talk about a very important foramen is jugular foramen. Jugular foramen, why I am saying it is important, because it is unique. The 3 cranial nerves crosses the jugular foramen. That is the only foramen where the 3 cranial nerves are passing through. So let's see where it is located first. So it is situated between the anterior margin of jugular process of occipital bone and posterior margin of petrous part of temporal bone. That is the gap between the petro-occipital suture. This gap is jugular foramen. Jugular because internal jugular vein passes through this foramen. So now we will see the structures passing through it. So to learn in an easy way, now we will divide it into 3 parts: medial, intermediate and lateral parts. Medial and lateral parts we will remember it as venous compartments, and intermediate one is nervous compartment. Structures passing through the medial compartment are inferior petrosal sinus, which is a dural venous sinus, and we look upon the lateral compartment here. So structures passing through the lateral part is internal jugular vein, which is an important one. That is the reason this is foramen is jugular foramen. Along with the internal jugular vein, which is the continuation of sigmoid sinus, along with it there is an artery called as occipital artery. And the intermediate compartment is left over now. So the intermediate compartment transmits 9th, 10th, 11th cranial nerves. 9th is glossopharyngeal, 10th is vagus and 11th is spinal accessory. So these are the 3 cranial nerves crossing the jugular foramen. The other bony prominences which we can see in the posterior part are the styloid process of temporal bone, which is seen in Norma lateralis also. It is a sharp conical projection near the tympanic part of temporal bone. And the blunt projection posterior to the external acoustic meatus, here laterally on each side in Norma basalis is seen as mastoid process. It is a prominent part of temporal bone present posterolateral to the styloid process. Medial aspect of mastoid process shows a deep groove known as digastric notch. And between the styloid and mastoid process, there is a small foramen called as stylomastoid foramen. So it is very simple to remember: stylomastoid foramen present between the styloid and mastoid process. This stylomastoid foramen transmits facial nerve and stylomastoid artery. So these are the important features and foramens and structures passing through posterior part of Norma basalis.